Okay, so let's sell insurance. Let's sell health insurance to our listener. For those you know, how well have they been taken care of for those who are on the health insurance here in Lagos?
Yes, okay, here in Lagos, using my hospital as an example, because we see quite a number of them. A lot of the elderly, they benefit from health insurance. So they are, like I said, they have chronic conditions like hypertension, diabetes. It covers their medications. Yes, and most medications are given monthly. Even if they have to do their basic tests, it covers. However, under the scheme, we have some investigations that the scheme covers. It's good to know that, so that they don't say the doctor said, there are some.
They are not paying for this. So
by investigation, it means that they get consultancies and then diagnosis.
Yes. So the first thing when they come, they've registered under the scheme. Yes, they are able to see the doctor. After seeing the doctor might request for some investigations. They send them for the investigations.
Investigation being tests.
Yes, the tests, the scans, the blood test, the scan, the X-rays, and all of that. And then thereafter, they get their medications under the NHIA. The medications, usually their medications is monthly, and they come back every month for us to see them again. Yes.
All right. Lagos Traffic Radio 96.1 FM. Health insurance today on radio is what you are listening to. And our guest in the studio is Dr. Adegbola, who is an expert in the care of the elderly. Now, we had those who had been calling for the past few weeks talking about, do you have package for elders? Do you have package for elders? Well, today we are letting you know authoritatively that we have package for elderly. And remember that the program is brought to you by A-Star Communications. They are the authority in this. And yes, we'll let you know that we have package for the elderly.
It's very important. I held it right on my breast. What kind of support do you think children can give the elderly ones, especially in the area of medical care? Now, before you answer that, bear in mind the African relationships we have. Sometimes we it's overrated or underrated depending on the situation. But what would you, under these conditions that you have mentioned, what would you advise children to do when it comes to insurance for the medical care of their elders?
Okay, thank you. So, well, the children, there's so many things they can do, for their loved ones, the elderly ones. So I will start with, the financial part, which is just one of the ways they can help them. Of course, provision of funds for these elderly people. Another thing is, as at the time when due. Another thing is support. They need, their support in terms of the elderly ones should not stay alone. They should stay with their loved ones. It's very important because, and again, even if they are staying alone, the children could get them some a form of caregiver to provide, the basic care for them. Because I saw a patient, the wife, she is 70, the husband is 73, and she does the running around for the man. When I got talking to her that the husband had to, go to another department, she just started crying. She said she can't do it, that she's tired. So I had to just put a call through to the
children.
Yes, to one of the children, and told her that, please, you need to get someone for your parents. Your mom can't be running around for your dad. It's really getting overwhelming. So that support is very important, and it's important for the husband, for the wives. Sometimes you feel you can't live with elderly people. They have exigencies, I think we should just be more accommodating, to have them around. This is the only time we have with them.
All right, so you can join our conversation. We still have about a few minutes to go. 080-09153-877127. But a question is here, and this is from Olamide. And Olamide is asking, for the health insurance, do we have age limits for the elderly to be taken care of?
No, we don't. There are no age limits under the health insurance scheme. All they need to do is just to, just apply for it. Go to their office, make inquiries, apply, pay the yearly due, and they are, they give them the primary health care facility they are supposed to be going to. So there's no age limit.
Okay,
So-
a quick update. Let me quickly take this. There is a report of a broken down truck loaded with cement at Sunbird filling station in Wadalasia and turning inward Ekpe, having mechanical faults. The owner have been contacted. Mechanic is working for its evacuation. We do not have captures to record that it has no effects on traffic. Regina, how did we get here? It's just about 5 minutes for us to leave.
I can't
How?
imagine.
Why?
I thought you
What
were going
happened?
to say we still have some 10 minutes at least, but we thank that person that asked that very salient question. But last word from you, Doctor, before we wrap it up.
Okay, so the care of the elderly is an important topic, and then it's good that we provide social support for our elderly ones, and it's also good to know that there is health insurance available for them, which would help reduce the costs of health care. As we know that the elderly ones, they have geriatric giants, they are at risk of a lot of conditions, and also it's important that when your elderly ones, when they make complaints, don't tell them it's old age. It's good to listen to them. Bring them to the hospital, let's take care of them. So it's important.
Well, thank you, Dr. Abiola
Before
Adegbola.
you round up and say
Okay,
thank you,
another question.
Olusegun is asking that we should repeat the contact number for inquiries after the program.
Oh, that's amazing. Thank you so much. I could call the number now.
Yes, go ahead.
0901 538 8634. Let me say it again. 0901 538 8634. You can send that. That's a WhatsApp message. And don't forget, save the number. Our WhatsApp community will soon be created so that you could go further with your questions.
And we also have our email address, which is info@healthinsurancetoday.ng. info@healthinsurancetoday.ng. You can send a mail to us for your inquiries, everything you want to know about health insurance that we are in charge of, or what the packages that we have. You can send a mail to us. Someone will respond to you promptly to get an answer for your questions.
And now to say thank you to Dr. Abiola Adegbola, a senior registrar from the Department of Family Medicine, LUTH, that's Lagos University Teaching Hospital. Thank you for sharing these useful tips on the topic care of the elderly. I think I've taken a cue. I would not do what I thought I used to do. I thought it was right. It's no longer right.
Okay, it is no longer right. And we also want to thank our listener for tuning in to Health Insurance Today on Radio, brought to you by A-Star Communications Limited. And we hope you found our discussion very informative and helpful. And if you want to reach out to us, like we said, the number again is 090-1538 8634. That's the number for you to reach out to us and contact us for questions and inquiries regarding the packages that we have for you.
And of course, don't forget to tune in next week, Friday, talking about Friday. Same time for more information and insights on health insurance. And until then, stay healthy and stay informed. I'm Regina Crisobodo.
Yes, and my name is Timmy Dio Anthony. I know we know that many HMOs in Nigeria offer health insurance plan for the elderly. And if you would like to know or find out how you can buy such insurance plan for your elderly, the ones in any part of the country, you just want to know more about the topic of discussion today, like we said, reach out to us on those numbers, which is 0901-538-8634, or send a mail to info@healthinsurancetoday.ng, and you would get your answers to your questions. And this is about the size of the program. We hope we have delivered. Regina, Abi?
I think we did,
Yeah.
and we're glad that our questions were asked and answers were given.
And if you still have more questions regarding health insurance, reach out to us. Next week, the program makes a return with another educative topic. Now, we're here to always educate you when it comes to health insurance and the packages available, the way you can take advantage of it for the ones that connect to you. We're always here every Friday from 4:30 till 5 p.m. to let you know what we are discussing. My name remains Timmy Dio Anthony.
And I remain Regina Crisobodo.
Join us again next week, Friday. Till then, have an amazing time. I'm still very much here. I'm still very much
You
here in
are.
the studio. All right, take care and God bless.